I think that MS care really ends up being very both individualized by the patient and what they need, but also by the clinician. I think that this, as a community, the MS community is incredibly aware, both the patients and the physicians, about the therapies and the options. So I think they all use the therapies, but then it gets down to their individual comfort with their approach to MS. And you can find clinicians even within the same city that had different approaches. I think there's some excitement around, obviously, every time we can bring a new therapy to the MS community, it's exciting to come in. And we know that there are patients that, will be well served and need that medication. So it's always fun to come and talk about new data, but we have new data about all our products, and, we continue to try to innovate and bring better understanding of our therapies so that patients can, use them appropriately and physicians know how to best prescribe them. Biogen continues to look at the various unmet needs for MS, and we are excited that there are going to be more therapies. Obviously, we just had one approved, Zimbrida, so that's another important option for patients who need it. So we will continue to develop new therapies and hopefully new ways to combat this illness. But we're certainly not complacent, and we're not satisfied yet. I think as a company, we continue to really think about remyelination, and we know that progressive parts of the MS spectrum are really areas that still need some attention, and I think that's where Biogen is looking into the horizon. We have programs that are thinking about that, and we're presenting some data on later in the conference on one of our therapies in development. So that's really where the future, we think, is being able to affect not only the inflammatory parts of the disease, but also the progressive part of MS.